Hi students, today I am going to talk about a very important topic very important question also, which is always I have seen in the test series of various high level institutes of India, means National Brand Institute, their test series also. This question many times I have seen this, and many students are having doubt about this question. So what is that question? How we can, by seeing a standard ECG, electrocardiogram, how we can identify a patient having the myocardial infarction. You all know that myocardial infarction, in common language we are calling it as what? Heart attack. So how, by seeing this standard ECG, how we can get the conclusion that really the patient is suffering from myocardial infarction or not. So here one thing I am giving you clue here. So before starting with that, some general things I want to discuss about the standard ECG. First of all, what is the ECG? ECG is a graphical representation of electrical activity of heart during one cardiac cycle. You all know that the cardiac cycle consists of both systole and diastole of both atria and ventricle. So here one thing I want to clarify, that you all know all this normal terminology. Again, just one very quick recap I am giving to you, that systole means what? Contraction. Systole is also called as depolarization. Okay, systole, depolarization, contraction, all are what? Having the same meaning. Now the second thing is what? Diastole is what? Relaxation. Diastole, repolarization, relaxation. These three words are what? Having the same meaning. Okay, so first of all, if you see this standard ECG here this standard ECG consists of how many waves? So as you are seeing here, okay, P wave, QRS complex and T wave. These are the major waves present in one standard ECG. Okay, now here this, and one more thing, what is the meaning of interval? What is the meaning of interval or segment? See, the time span between the successive waves in ECG is called as the segment or interval. For example, the time span between this P wave and this Q wave, okay, P wave and Q wave, this is called as what? PQ segment. Okay, or PQ interval also you can write to this. Okay, suppose here S wave, this is the S wave and this is the T wave. So the time span between, the time interval between S wave and T wave is called as what? Interval or segment. So it is called as ST interval or ST segment. Understood the meaning of segment or interval? Okay, the time span or between the two successive waves is called as the segment or interval. Now here one thing I want to discuss, once very quick recap. This P wave, what is this P wave is representing? The P waves represents the contraction or systole of both auricles. If this P wave is coming, that is the contraction or systole of both auricles. Now next is this what? Q. This Q wave. This Q wave is representing what? This Q wave is representing the starting or beginning of the depolarization or systole of ventricles. Both ventricle, left ventricle as well as right ventricles, both are contracting equally at the same time. Clear up to here? Okay, so Q wave is representing the beginning of the starting of ventricular systole, means ventricular depolarization or ventricular contraction. These three statements are correct for this. This QRS complex, what it is showing? It is showing the complete ventricular contraction or complete ventricular systole. If both right ventricle and left ventricle both are undergoing contraction simultaneously, okay, so that peak of that systole is what? QRS complex. It is showing the what? Contraction or systole or depolarization of both ventricle. Now one question will be arise in your mind. This P wave is showing the systole or depolarization or contraction of both atria. Okay, and this QRS wave, this wave is showing what? The contraction of or systole or depolarization of both ventricle. Now where is the repolarization or diastole or relaxation of atria is shown in this ECG? So for that I am telling that the repolarization or relaxation of the auricle or atria is hidden in this QRS complex. So keep in mind. Clear? Now one more thing. After that, here This is what T wave. So T wave, what T wave is showing? T wave is showing the relaxation of ventricle. That means from the S wave, okay, repolarization or relaxation of the ventricle starts, and till T wave both the ventricles totally coming into diastole condition. That means both are what? Both the ventricle totally become what? Relax. So this was about the general ECG. Here the new point which I have told to you, that in which this is what? Systole of atria. This is what? Systole of ventricle. This is what? Diastole of ventricle. So where is the diastole of atria? Both atriums, left atrium, right atrium. That is hidden in this QRS complex only. Keep in mind. Thank you.